This week, we're roasting another of our lovely subscribers. Hi guys, welcome back to the channel. I'm here again with Dr. Kishan and Dr. Ewan, and we've got another photo for you which has been submitted by one of the subscribers to the channel, and we will be letting you guys know what we would choose if we had carte blanche, what we would do with the patient, because we often get questions about, is it going to be different if a person sees a different doctor? So up first we've got Dr. Ewan. Let me just grab it.
Okay guys, so we have this chap here. I don't know how old he is, but he looks like he's probably in his 20s, do we think? Yeah. So, he's a good looking guy to start with, so we have something good to work with. I think what we all tend to do at the clinic, we tend to just split the face into thirds, don't we? And just helps us structure our treatment plans, but helps us look at their proportions as well to see if anything's out of range. But to me, he looks fine for his thirds. He's got quite a nice low hairline, which is good for a guy to have a low hairline. Actually makes you look younger than something that's receded back. So he's pretty lucky. So I think looking at his overall skin quality, there's obviously some problems with acne, which a lot of people, if not most people, suffer from at some point in their life. So I think for him, a big difference, even if we didn't touch him with a dermal filler, is going to be improving his skin health. I think for people with acne, really topical wise, for me, I like using retinols because it's going to help with improving the skin turnover. It fights the acne bacteria as well. So for me, that's a good start. It will just improve the quality of the skin before we even do anything. Then looking at the forehead, I don't know if he's had any treatment done before. We have a few kind of static lines and wrinkles kicking in. So if he wants to prevent them from getting any worse, something like toxin, Botox, something like that will help soften them, stop them getting any worse. If they're already in your skin, quite difficult to get them out. You can actually, in a younger patient, tend to find that they improve. If you're a slightly older patient where your skin's not as resilient with the collagen and elastin, then maybe not so easy. But I find that if you don't want to get any worse, it certainly won't get any worse with a bit of Botox. We have to be careful in the upper face for a man. If they want to stay looking masculine, which most men do, but not all, we place the Botox specifically that the brows don't elevate at the tail, for example, which gives a more feminine look. So I would keep his brows kind of in the same position that they're at right now, because I like where they're at. So then moving around, he's lacking some volume for me in the temple area, which we would lift out with some dermal filler. That's going to help support the brow. Then mid-face wise, we see this ligament show. So in our faces, we have this ligament that comes down here and it's dividing the fat compartments in the face. So we find that some people genetically have these ligaments really deep. Other people, over time, as the fat compartments start to shrink, which happens with age, they become more obvious. So quite often a common complaint is that I've got these lines on my cheek that I never had before. So I don't know if he's always had them. I suspect he probably has, but we can improve this with some volumizing fillers. So where he's a little bit flat in the face around here, I would certainly think about building that forward. That will help support the under eye area. If there's still a tear trough, which is that kind of groove beneath the eye, then at that point, I would flow a little bit of product in there if need be. It might help with some of the darkness and pigmentation you see in the area. Some of that might be vascular, some of that might be because of his skin coloring, but I find that with skin improvement products under the eyes, like a tear trough filler in the right case, just by reflecting the light better in that area, it looks less shadowed. We can also use a skin improvement product like our light eyes treatment, which helps a little bit with pigmentation. And if there's any vascular issues, it will help improve blood flow. So working my way down, I have a sneaking suspicion that he has had his lips done before.
Really?
I do. I have a sneaking suspicion.
Get away.
I mean, that's fine. Men have lip fillers all the time. For me, I think there's still a little bit of discrepancy between the top lip and the bottom lip. I find that the top lip is at least at the moment the same size as the bottom lip. Some people find that that's what they want and that's fine. He might be really happy with his lips and that's great. I just find that for me it's a little on the fuller side for what I would personally aim to, if I had a fresh canvas. It may be that he just wants to wait for that to go away. It may mean that he wants to have that dissolved and start again. We could still fill them, because I'm assuming if he has had his lips done, he would want more definition and a little bit more volume, but I'd maybe just do this in a slightly different distribution. If he wants a 1-to-1 ratio, that's fine. I just would maybe not go for the border so much. There's definitely some dryness, so we can improve the hydration with a hydrating lip filler. We can use a slightly denser product if he does want volume. I think I'd just switch up the kind of symmetry. For the lower face, he's got a nice kind of squarish jawline. His chin is pretty square, which I think for men, if we look at these, drop these lines down, they're looking pretty good. My drawing is terrible. However, I'm quite happy with the width of his chin. I just think that it could be squared off a little bit here. Just on that side, it's a little bit higher, so we could square that off a bit. And then we'll see him from the side, but most men that want to look model-esque will enjoy having a jawline filler just to kind of sharpen everything up. So we can have a look at him from the side in a second.
Should we do that?
Yes, I think that's fine. Okay, looking at him from the side, I'm definitely seeing more of this temple hollowing now, which we saw on the front. So I think that would be a really nice place to start for him. We're still seeing this kind of ligamentous show down here. For a man, if you're building out a kind of model cheekbone, usually the younger patients will want that if they're wanting a more sculpted look. You want to try and keep it in this plane here, more alar tragal line, rather than for a woman where you would contour it kind of up in that vector. So for him, I'd want to perhaps do a bit of horizontal strengthening. Looking at the nose, there's definitely scope for us to just straighten the dorsum of the nose up. We could add a little bit of volume on the tip just to kind of stop it from drooping down. If that's a concern of his, we can certainly just improve the overall profile of the nose. It wouldn't take a lot of product at all for him. He's got a good base of nose angle. You could argue that it's a little bit short and you could open up to about 90 degrees. That's quite a pleasing angle for a man's nose. So there's work possibly to do on the nose. We see the lip projection. It looks like he has had filler in the lips. When I'm looking at the chin, I think there's scope for us to bring this chin forward a little bit for him and work in this crease just to strengthen up the jawline, make it look a bit more masculine. And then why not, in for a penny, in for a pound, let's just do this. Let's make him look like top model. I'm pretty happy with that.
Okay, cool.
Okay, so I mean, I agree with pretty much everything you said, right? I mean, we're on the same page. From this angle, though, I think the things that sting out to me are, he's probably missing a little bit of temple volume, I think, and I think that will support the brows. And actually, the tail of the brows are actually going down, so I think just a bit of support with temple filler could be quite nice. And you mentioned these static lines that we would want to prevent with Botox or toxin or whatever your neuromodulator of choice is. I was thinking maybe we try a really soft filler product in the forehead as well, perhaps to bring that out a bit, not too much so that we sort of remove that sort of masculine profile, but just enough to give support to that skin so it doesn't sink further and form more static lines. And I think his frontalis muscle is doing its best to lift up the brows, but because of the lack of volume here or the lack of bony support here, I think these static lines are forming. I completely agree with you about the mid-cheek groove. I mean, that would go a long way. A bit of filler there would go a long way to sort of lifting his face. And yeah, maybe, and I like doing tear troughs, so I would do that as well. I think he's got a really great jawline already, but there's no harm in accentuating it more. I think they say that the limits of the chin should be a little bit wider than the base of the nose in male patients. So I'd agree with everything you said pretty much, and just those other little tweaks. So if now we look on the side view, I would put a little bit of very soft product here, and that would give him a little bit of strength, again without putting too much so it doesn't ruin the masculine profile. So another thing I noticed is there's some post-acne scarring, and there's some textural changes in his skin as well. So this would be a great candidate for INTRAcel, I think.
Definitely.
And perhaps some sort of maybe medium strength peels as well as home skincare, just something to regenerate the epidermis, compact down the stratum corneum, and give a smoother, more sort of healthy look to the skin. Because the way it's reflecting light suggests to me that the acne's been going on for quite a while. And also, I think the nose would look great with a little bit of tip definition, a little bit of opening the angle here, as you say. And lastly, I agree with you. The jawline would be great for this patient.
He would be so good for INTRAcel, you're right. INTRAcel would be great.
Yeah, but not a lot different to what you said. I'd probably agree with pretty much everything anyway.
Okay, stand aside for 20 mils. Okay, so I would definitely fill these forehead hollows here. I don't like the side profile so much. You might even have to take it all the way round into the temple here, because I feel like he's a little wide here in comparison here, you know, but we're getting that like slight peanut head look coming. I'd also do mid-cheek groove as well, as you both said. Under eye, you could do the Sonicos maybe, because he's got these fine lines just starting to come there and they're pretty tricky. I'd also, as you both said, crisp up, particularly that side of the chin, make the chin look a little bit wider. I'd do the crease of the chin as well. You could maybe play with the proportion of the lip if you didn't want to make them any smaller. Maybe just add a tiny bit into the lower, in the middle third. Skin improvement, definitely. What you were saying about doing the INTRAcel, I like it. You could also do some Juvederm Volite maybe, directly into the
little pits.
Yeah, into the pits themselves. I think from this angle as well, you can really see how much volume loss there is just across the forehead here. So I'd fill that whole thing, I think, make it flat. Yeah, why not?
It's still got a nice sort of slope to it as well.
Yeah, I think as long as it's straight, we're good. Yeah. Obviously, you don't want to make it curved, but there's plenty of scope to make it flat. I'd bring the chin forwards ever so slightly and do that. In fact, do the whole of the jawline. I think that would look really nice on him.
For sure.
Cheek, as you said, but keep it nice and horizontal. Little bit into the nose as well. I think that would be nice. I think he's going to get good improvement though from doing some skin quality changes, because that just gives you a really nice global overall improvement without, you know, having to touch all these different areas. And I think often patients can be, you know, a lot more comfortable with having skin improvement rather than injectables.
It's a good way to start.
Yeah, definitely. And it's never too early to start, I think.
Okay guys, it looks like we're all on the same page. Yeah. Not surprising, because we're seeing far too much of each other at the moment. However, if you have any questions at all, leave them in the comment section below and we'll get back to you as soon as we possibly can. Be sure to check in next week for some more fun. See you later.
Bye.